I've been getting a lot of questions lately from pet owners whose pets have recently been diagnosed with early kidney disease and they want to know what to feed. Well, this is confusing, and unfortunately, the knee-jerk reaction of your veterinarian is often just put them on prescription kidney diet because that's what they're told in school and that's what the pet food companies tell them, and um, it's generally not appropriate, especially early on. Now, there's a couple of things that you might want to change, and that can depend on the stage of your the kidney disease. But the first thing is get them off of dry food. Water is the most important nutrient for the kidneys. We need to keep these pets hydrated, and dehydration can put a lot of stress and pressure on those kidneys and cause more damage. So, a dry food is going to be dehydrating, and one of the easiest ways to keep your pets hydrated, especially if they're not good drinkers, but even if they are, it's hard to hydrate from a dry food. We want to make sure that we put them on preferably a gently cooked home or even a raw diet if they're used to that, but even a canned food or something that has a lot more moisture than a dry food is going to make a huge difference. But short of that, unless they're in stage 3, and that's a good question to ask your vet. Are they in, what stage kidney disease is this? Stage 1 and 2 do not need any kind of diet change. And in fact, I feel that protein restriction at that stage is actually detrimental. Does not protect the kidneys whatsoever. In fact, it makes it harder for them to heal and repair the way they need to, because protein is critical for that. So there's a lot of subtleties to kidney disease, and there are actually multiple forms of kidney disease. One that might require a little protein restriction, depending on the level, is if your pet is diagnosed with protein-losing nephropathy, PLN. What that means is that there is too much protein in the urine. Now, that requires a special test, a urine protein creatinine ratio test, UPC. If that was not done, just a straight urinalysis that has a protein of +3 means nothing. Okay, so the extra tests need to be done to make that kind of diagnosis. At that point, your pet should be checked for hypertension because high blood pressure can contribute to that disease, and that needs to be managed. So there's a lot of different nuances where we don't even get into diet change yet. In that disease, at certain points, yes, protein restriction is definitely very helpful, but it does not have to be super restricted. In fact, it's only recommended to decrease by 25%. So if you're starting on a raw diet, a fully balanced raw diet, I want to make sure if you're feeding raw, that's great, or gently cooked, that's fantastic. Just make sure that they're getting all the nutrients that they need, because nutrient deficiencies can contribute to kidney disease as well. So assuming that they're on a whole food diet or even a high protein canned food, there are a few of them, you only need to restrict that protein by 25%. So sometimes if you're on like a raw diet that's 80% meat, you can actually just add a bunch of veggies and cut that protein quite a bit and still provide all the nutrients that they need. But work with a veterinarian that does nutrition, so that you're making sure that you're not restricting any kind of nutrients. But regardless, that's a whole different form of kidney disease and not the most common. The most common is chronic kidney disease, which is a chronic degeneration or decrease in kidney function. And that one we look at blood markers like BUN, creatinine, and SDMA. And that's the one that gets staged. Stage 1 is just maybe the urine is less concentrated and SDMA is starting to creep up. Stage 2 and 3 will have different specific levels of creatinine and SDMA as markers of those stages. There is no need to restrict protein or even significant diet changes until stage 3. And at that point, phosphorus becomes huge. Protein might be a little bit of an issue. Each patient is different. But yes, that's when I do believe that diet changes are important. Now, the kidneys can reflect other diseases in the body. I've had dogs with severe periodontal disease with kidney markers that made them look like they were in stage 3 kidney disease. When those teeth were cleaned and the rotten teeth and the infected teeth out and antibiotics given, all kidney values went back to normal. That doesn't mean that your dog will do the same thing, but look at those teeth. It's important. Other diseases in the body, like I said, hypertension can contribute to kidney disease. We need to manage entire health. The kidneys aren't just functioning on their own. And so we need to look at everything else. Even a urinary tract infection. Make sure that's not contributing to the problem. So before you knee-jerk to kidney diet, and certainly not to a dry kidney diet, I think that is an oxymoron. That's just should not even exist. But, let's look at everything else and make sure that they are in the appropriate stage and that we're managing things properly. I hope that helps.